Vaccine controversies started with the first vaccine in 1796. Jenner's cowpox vaccine was mandatory for all English citizens, and refusal to vaccinate was punishable by fine under the Compulsory Vaccine Act. 98% of the population was vaccinated by the beginning of the 20th century, but some held out. A mandate led to the Conscience Clause to quell the voice of the opposition, who claimed that the vaccines didn't work and that they were dangerous and contained harmful contaminants. Some argued that they were against religious doctrine, and others said that the rates of disease were so low that they were unnecessary. The pertussis vaccine was also another vaccine controversy. In the 1970s, in the United Kingdom and Sweden, reactions to the vaccine caused a huge drop in immunization rates. Large epidemics then followed, mostly in religious groups, because of refusal to vaccinate. The hepatitis B vaccine was developed in the 1980s. Hepatitis B is a virus that causes liver cancer. Since the United States started routine hepatitis B vaccination, new cases have dropped by about 82%, mostly among children. The hepatitis B vaccine was first studied in 3 groups of vulnerable patients: dialysis patients, dialysis clinic staff, and male homosexuals were the 3 groups studied. The trials indicated the vaccine was almost 100% effective given 3 doses. But among the homosexual group with HIV infection comorbid, the vaccine only worked for 50% of the patients, and many of those patients with HIV also became chronic carriers of hepatitis B from the vaccine. Thus, the vaccine was only indicated for non-HIV infected individuals. And many homosexual men didn't get vaccinated because rumors spread that the vaccine was a conspiracy to infect the gay community with hepatitis B. In the 1930s, vaccine manufacturers started adding thimerosal, which is an organomercury compound, to vaccines. This helped the vaccines inhibit bacterial growth. In 1997, the USDA Mercury Modernization Act required mercury-containing items to be reviewed for exposure risk. The CDC and the American Academy of Pediatrics determined that too much mercury was in vaccines and suggested the removal of thimerosal from them. Parents blamed autism on thimerosal and filed thousands of lawsuits. 3 large studies found no link between vaccines and autism, but parents still blamed thimerosal for autism. Vaccines have had some success. In 1980, smallpox was considered eradicated by the vaccine, and polio is considered eradicated from the Western Hemisphere, with only 3 countries remaining with rates of polio. Nigeria, Afghanistan, and Pakistan are the only places in the world left where polio is prevalent. This polio epidemic is still occurring despite massive vaccination efforts from global health organizations. Vaccines have also been developed to help protect against cancer. The hepatitis B vaccine protects against liver cancer, while the Gardasil vaccine protects against cervical cancer. There are a few different vaccines in development to protect against skin, prostate, and lung cancers. The lung cancer vaccine was developed in Cuba. It has been in use in Cuba for years, but it has not yet passed the FDA drug testing to be used in the United States. Herd immunity is defined as the threshold proportion of people in a population that are not susceptible to a disease and thus can stop an outbreak from becoming an epidemic. This threshold depends on the virulence of the disease agent, the efficacy of the vaccine, and the social network of contacts in the population. Herd immunity allows public health officials in planning and implementing immunization campaigns. The target group is generally the group with the most social contacts. Herd immunity does not protect against non-contagious diseases. Diseases like tetanus, yellow fever, and typhoid can still be spread. The progress of the epidemic is regulated by the number of susceptible and the rate of contact between the infected and the susceptible. The less the outside contact, the less likely the epidemic will spread. Overlapping exposure does exist, so if you're infected and come in contact with a susceptible more than once, it throws off the variation of the model. Variations in contact make it difficult for public health officials to determine the course of action. The herd immunity study in the textbook was a study done to show how variations of population characteristics affect the rate of contact between infectious cases and susceptibles. This study determined whether epidemic spread would occur. There were three basic assumptions of the study. One, that individuals were either susceptible or immune. Two, that infectiousness period was short and the same length for all infected. And three, that the ill were not withdrawn from the study. The study used the Reed-Frost model, which is an epidemic model based on random mixing. The Reed-Frost model states that the probability of contact within any time interval is the same for every choice of two individuals in the population. So that means that if you pick two random people from the population, their probability of contact with an infected individual was the same. The Reed-Frost model used intervals of time for infectivity. The first interval indicated the first week of infection, where the infected was not infectious to others. The second was the beginning of the second week, where the infected was infectious to the others. And the third was the beginning of the third week, which the infected was no longer infective, but permanently immune to the disease. In this model, adequate contact must have been made between the infectious and the susceptible in order for the susceptible to be infected by the disease. This model summarizes both infectivity of the agent and the social habits of the population. It also infers that changes in the population size are proportionate to the changes in the immune, and they do not influence probability to disease spread. This study was ultimately used to determine what population must be immunized to lower the chances of outbreak. The data that they used to determine this was the method of spread, the season of the year, the number of susceptible and their distribution, social habits and mixing of groups, and subgroup contract rates. Overall, successful vaccination programs reduce susceptibles in all subgroups for a small probability of spread. They target low economic neighborhoods for a large amount of susceptibles with frequent various contacts. In the United States, vaccination has eliminated or reduced a wide range of once common diseases.